We gave Rex's medical records and autopsy report to Professor of Cardiology at Wayne State University School of Medicine and America's healthy heart doctor, Dr. Joel Kahn, who says Amanda just simply would never win her fight in court. Doctor, thank you for being here. I really appreciate it.
Thank you, Dr.
You have spent a lot of time really deconstructing these records and going back in time.
There's three things they need to know. Number one, the medicines that were given to their father were all ordered by healthcare professionals, not by the nurse. The nurse cannot give a medication without a medical order. All these medicines were ordered by people who knew the entire medical situation. Mm-hmm. It's very important. There's no cover-up in the chart about that. Number two, he had extremely advanced disease on autopsy. There is no question on autopsy. One, he had end-stage lung disease that had been determined and discussed with him, no treatment in the world for. He signed papers to just be treated comfortably. It's called DNR. His days were numbered when he signed that. Number two, he had unknown advanced heart disease, and basically on autopsy was having a heart attack on the evening he passed away, according to the description of his heart arteries, my area of expertise. He was having a heart attack. Of course, nobody knew this beforehand, and that's the case with so many millions of people walking the streets of America, but it's number one cause of death in the United States. And he also had an unexpected, it's called an aneurysm in his belly that could have ruptured at any moment, one of the largest I've ever seen, also typically undetectable. And the third thing, and finally from the autopsy, the toxicology was clear. It's a bit odd, and I understand Amanda's confusion. The fentanyl blood levels that were drawn were actually drawn on blood samples before he died, actually before he was given fentanyl. Of course there's zero, that's not a cover-up, it's a timing issue. It's unreliable, and now it's impossible because the blood sample wasn't retained to know what that level was, but it's actually unreliable to measure it.
And one of those was 6 hours before his first dose of fentanyl the day that he died. It was in the afternoon.
The third sample was before, same with the morphine. And but it turns out even if we had that blood sample retained, which most medical examiners don't do 2.5 years later, it's an unreliable assay to do it. So it's actually a question she needs to move on beyond, because it can't be answered in a court of law, on a TV show, or any other situation. He died of a heart attack in the setting of 2 other lethal conditions.
May I ask you a question?
Absolutely.
So in the when I did the State Board of Nurses complaint, I was told that there was a second set of medical records that were produced to them besides what were given to us, the family, even though we went over a year after to make sure that all the hospital records were complete. And the investigator for the State Board of Nurses said that in the end of the documents that it shows that your father said that he was uncomfortable and he requested these medications, but you had said if his oxygen level was at 72%, he would not be of sound mind to where we could take his Book of Mormon as something valid. So why can we take his request for said medication as being valid, but we can't take his Book of Mormon as being valid?
Well, I do a lot of courtroom work, and it's very common to get an incomplete set of records, then a complete set of records. Not to say a fraudulent would be criminal, but incomplete moving to every page. And it's frustrating that didn't happen right at the beginning. It would seem simple, print them off and provide them to you. But I agree with you, there has to be medical and nursing judgment involved in ordering the drug and when to actually administer the drug that goes beyond the patient input. And understanding your father being a nurse, there could be some interplay. I agree with you. He would not likely have been of sound mind and body to ask for or reject the medicine.
You and I have both been in the room with these patients at the end stages where they're drawing a breath every 15 or 20 seconds, and we don't need a patient to tell us that they're in agony at that point.